Hello, everybody, and welcome to today's presentation, all about hormones, perimenopause, menopause. Today, we have joining us Dr. Daniela. She is a licensed naturopathic doctor for almost 20 years, practicing and living in the Halton region. She is deeply dedicated to helping her patients figure out the root cause of their health concerns and supporting them with the foundational support like healthy eating, targeted supplementation, counseling, and lifestyle recommendations. For those of you who don't know me, my name is Dr. Brianne Callanan. I'm also a naturopathic doctor, and today's presentation is on behalf of Health Buddha. So thank you, Doctor. Can't wait to get started chatting all about hormones. So why don't you kick it off by telling us a little bit about when should females in particular start thinking about perimenopause and menopause, and what are some of the symptoms they should look out for?
Yeah, absolutely. So welcome, first of all. Thank you so much for having me today. In terms of perimenopause, so the thing is perimenopause is a really frustrating time, I guess you could say, because a lot of women are experiencing changes to their body, but they don't really know what's going on. Is this associated with hormones? Is it not? And a lot of times we don't really think about our symptoms being associated with hormones because maybe it's too early, right? So perimenopause actually occurs it can be anywhere between 2 to 10 years before menopause. So, and the average age of menopause is about 45 to 55 years old. So theoretically, we can start going through perimenopause as early as 35. So very, very early. And, like I said, it's a very confusing time for women. And I almost like to call this our second puberty. So if you think about way back when we were, tweens and teens and our hormones were changing and we first get our period and, we were taught in school what's going to happen to our bodies, but you don't really get it until you're actually going through it and you're experiencing maybe cramps and migraines and acne and breast tenderness and moodiness and all of these things, and you don't really understand what's going on. And so that's puberty. And I almost feel that women are experiencing that with perimenopause in the sense that, there's all of these symptoms and they don't really know, is this perimenopause or is this not, right? And so a lot of the more common symptoms that we see are hot flashes is very common, night sweats, and these can be maybe you're only getting one a month, or it can be very regular, right? Changes to our sleep, that's another concern that we hear a lot. So insomnia is actually very, very common. Fatigue is another common complaint that we hear of, as well as mood changes, forgetfulness, even changes in our period, right? So you may find that your cycle is extending and it's longer than it normally is, or perhaps it's shorter, or that your actual period is longer. So instead of like a 5-day period, maybe you're getting a 10-day period, right? So those are some of the common ones, as well as weight gain. So weight gain, especially around that midsection, again, is where one of the very common things that we hear about. But there's also a lot of really common symptoms. I'm not going to call these uncommon, but they are common symptoms, but we don't necessarily hear about them very often because I think a lot of women don't really link it to hormones and to perimenopause. So joint pain is one of them. So that's something else that, women start complaining about, and they're like, I don't know, like, do I have, something that I'm developing in terms of, like musculoskeletal issues, but it can also be associated with hormones, urinary tract infections or yeast infections, or even the feeling that you have one of them, but then you go to the doctor, you get tested, and all of this testing comes back negative, right? So it's almost that feeling like you have an infection, but you don't. And this is due to that decrease in estrogen happening in our body. Loss of breast fullness. Nobody talks about this, right? As our estrogen levels decrease, we actually see our breast fullness decreasing, changing in body odor, bloating, decreased muscle tone. Like these are all things that are common, but not necessarily really talked about a lot. So.
And I love that you mentioned that there's, a decent amount of education for young women about their cycles and what they can expect. But the information that's available for women who are going through perimenopause and menopause, there's not enough conversation around it for women to even recognize what could be the abnormal signs and symptoms to look out for. And a lot of the things that you mentioned, even though they're common, I think one of the important things for individuals to recognize is just because something's common doesn't necessarily mean it's normal and that it's not treatable.
Absolutely. And this is one of the things that I do like to say is that, perimenopause, menopause are hormones that are changing. Like change is inevitable. It's happening. It's going to happen to all of us, right? But suffering is optional, right? So you have that choice. You don't have to necessarily just say like, okay, that's it. Like I'm going to have hot flashes for the next 10 years, or, I'm going to experience this joint pain because I am, in perimenopause, right? So that's one of the things that we really do need to understand is that there is something that we can do about this, right? So it is our option to make some changes.
And when women begin to experience these symptoms and they feel like, okay, perhaps this might be perimenopause, what is the best first step for them to take?
Yeah, absolutely. So first off, I say, get some testing done. I think it's great whether you go to your family doctor, go to your naturopath, nurse practitioner, whoever your medical professional is, go and have a conversation with them, first of all, because they need to understand what you're experiencing. They need to understand that these symptoms aren't something that, they're something that they're new for you, right? So something is changing in your body. Hopefully they will do testing. You can also ask for testing, and there's a lot of different great tests out there. So sometimes people will start with a blood test, right? And see where your estrogen and progesterone and testosterone levels are, where your cortisol level is. Cortisol is that stress hormone, and that really plays in also to our hormones and how our body is responding to hormones, right? So the more stress that we have, oftentimes the more symptoms that we will experience, or more severe symptoms, right? So that's going to be really important. As well as having full thyroid panels, having full nutrient level panels, right? So we know when we are deficient in certain nutrients, or even like lower levels, that we can also be experiencing these perimenopausal symptoms worse than if we kind of had those optimal levels, right? So first of all, doing some blood work, like I mentioned, like a basic blood panel is a great place to start. There's also some fantastic panels that you can do. Some urinary panels. The one is called the Dutch test, and this is more of like those hormone metabolites. So it really shows us what's going on with our hormones. So we have, 3 different forms of estrogen, and it'll show us if our body is actually holding on to that good estrogen and really processing that bad estrogen that we don't necessarily want hanging around very much. So it will show those ratios, right? So that's a much more in-depth lab test, but it's also a great one to do. So those are the first things that I usually say. Go and speak with somebody and get some testing done. One caveat that I will say, though, is that when we're in perimenopause, our hormones are all over the place. So if you get a blood test done and it comes back and it is within normal ranges, that's fine. It doesn't mean that the symptoms that you're experiencing are not real, right? And so maybe 3 weeks later, you get it tested and it's all over, it's somewhere else, right? So just because the lab tests are normal doesn't mean that the symptoms that you're experiencing aren't real. So we definitely need to validate that for women.
And pair the symptoms with the labs together to
Exactly.
develop the
Exactly.
treatment.
Yes.
Okay, so the patient comes in, they have their blood work done, they're starting to see signs of perimenopause. Perhaps we're seeing reductions in estrogen and progesterone. What are some things from a dietary and lifestyle perspective that individuals can do that you've seen create a more favorable transition or an easier transition into menopause?
Yeah, so there's 5 areas that I like to really focus on. One obviously is diet. So in terms of diet, we know that women who eat fruits and vegetables, lean protein, healthy fats, really do actually have a reduction in symptoms compared to women who have a highly processed diet. So really making sure that you are eating a lot of good, healthy foods. The Mediterranean diet is a great place to start because you can also modify it based on your lifestyle, right? So if you want to do more low carb or vegetarian or pescatarian, it is a really great place to start. You want to make sure that you're getting a lot of really good healthy fats in there. They're really important. So whether it's avocados, fish, nuts and seeds, right? Like that's going to be important for our hormones. Our hormones do need those healthy fats in order to function properly. Green leafy vegetables, especially those cruciferous vegetables. So broccoli, cauliflower, kale, those are all really important within our diet. Also, we want to look at foods that contain isoflavones, which is actually a plant estrogen. And these can be really beneficial for perimenopausal symptom relief, right? So these are soybeans, chickpeas, lentils, flax. So, there's actually studies that show women who actually eat these isoflavone foods actually see a 19% decrease in hot flashes. So there's actually studies been done on, specific foods, right? Another thing to think about in terms of diet is that, choosing organic foods and actual personal care products as much as you can, because we know that way we're limiting exposure to xenoestrogens. And xenoestrogens are those estrogens in our environment that can actually bind the estrogen receptors in our body, but they're not necessarily the good estrogens for us, right? So we really do want to avoid those things. Things that we may want to avoid is caffeine, alcohol, sugar, and even like charred meat. So these are the things that can actually make our symptoms worse. So that's one of the first things in terms of dietary wise that I speak about. The other thing is also protein intake. So we really need to make sure that as we get older, we're getting enough protein in our diet. So really consuming, 1 to 2 at least minimum meals with protein every single day that has about 30 to 45 grams is really important for maintaining that lean muscle that we need, because we know, again, that is something that really starts decreasing as our estrogen levels start to decrease. So that's my number 1. I have 5 different things. So the next one is sleep hygiene, and sleep hygiene is, really going to bed on a regular schedule, making sure that your room is dark, turning off those devices, making sure you're not drinking caffeine past 3 o'clock. And some people, you need to think about it in terms of how you do, but some people don't do well with exercise at night, right? So, they find that they exercise at night and they're a little bit too high energy. So just something to think about because, everybody's different. So if you're not sleeping well, those are a few things that you might want to think about. Just talking about exercise in general. Also super important. We know that we do, again, need to really maintain our muscle strength and our muscle mass. We know that that's really important for bone health in the future. So definitely, aerobic exercise, weight exercise is really important. Making sure that you're getting both in on a regular basis is something that we need to do. 4th is mindset. Okay, so this is really interesting. So There's actually been studies done showing that women who actually dread perimenopause and menopause, and who talk about it in that way where it's like, like, I don't want to experience all this, like they're talking down about it, actually have more hot flashes and more negative symptoms during those perimenopausal and menopausal years. So, as much as nobody's really looking forward to losing those hormones, really just try and have a really positive outlook and perspective on it. Okay. And then last is all about like supplementation in terms of nutrients. So I already spoke about diet and really where we want to be getting those nutrients from our diet and eating a lot of really nutrient dense food. But a lot of times it does come down to taking some extras, right? So if that means making sure that you're getting enough vitamin D3 and K2 in, right? Like that's definitely something that is very difficult to get in, especially, living in Canada in the winter months. We're not necessarily getting all of that exposure to the sun all year round. So that's going to be very important, but also, some extra support. So perhaps some magnesium or some melatonin for sleep. B vitamins for stress is really important. Omegas, right? I mentioned how important, omegas are for hormones in general. So those are some things that can really help us out. There's also some herbals. So again, stress support, we have ashwagandha, we have rhodiola. So these are some adaptogens that are really great for, helping support our stress levels, which in turn can help decrease those symptoms of perimenopause and menopause. Black cohosh, chaste tree, these are some specific herbals that we use more for hot flashes and breast tenderness, right? And even some of those concerns that we have with our period, right? And then there's like valerian, passion flower, things that are really helpful for anxiousness and just relaxation and sleep. So I know I've gone through a whole bunch of things here, but those are really my top 5 things that I like to focus on in terms of really helping support our hormones.
And that was fantastic. A great overview and summary of all the different aspects to start on first. Now, for individuals who have the testing, they've done all the foundational aspects. There is also the option, and I'm wondering if you can expand a little bit more on it in terms of hormone replacement therapy. There's also a lot of misconceptions with hormone replacement therapy and concerns that patients have. So can you expand a little bit on when would you consider that for patients, and what are some of the conversations or questions patients should be asking their doctors?
Yeah, absolutely. So there is hormone replacement therapy. The type that as naturopaths that we use is BHRT, so bioidentical hormone replacement therapy. There's a misconception that it's not regulated. It's not in a consistent amount that you would get. What it is it is a prescription. Again, I'm in Ontario, Canada. You need a prescription for it. It is a prescription through a compounding pharmacist. And what it is the estrogen is made from soy and the progesterone. So they're both natural products, right? And the progesterone is from wild yams. So they are natural compounds, but they are dispensed in a regulated amount, right? So again, it's made by a compounding pharmacist, and we use it in cream form. So this is one thing that I find my patients actually like using the bioidentical creams, because it's very easy, it's very consistent. They know that they're getting a regular dose. For my patients, what I often do is I do the testing, we see where their hormones are at. They obviously are experiencing symptoms. Sometimes we will start with some of the herbals that I've spoken about. So maybe I will do a herbal with some black cohosh or some chaste tree, as well as other nutrients for support. Sometimes I find that's only going to get you so far that I actually need to take that next step of that bioidentical treatment and therapy, right? The misconception with it is that there is going to be an increased risk of estrogen related cancers. This is what happened. There were studies done. Traditional medical doctors are not using hormone replacement therapy as often because there was a study done showing this, and there was an increase in breast cancers. This does not pertain to bioidentical hormone replacement therapy in the sense that the actual ingredients that are being used are different. One thing I would like to say is that we have estrogen receptors all over our bodies, right? So not necessarily just in our ovaries, we have estrogen receptors in our brain. This is why we get symptoms of forgetfulness, hot flashes, right? So those estrogen receptors need to be filled with something. And we want, as we get older, we actually want to maintain that estrogen. That is what keeps our bones strong and keeps us young and feeling good. And so it's almost that choice of putting good estrogen in your body or bad estrogen. And that's where the bad estrogen is those xenoestrogens. And again, we know that the hormone replacement therapy can bind those estrogen receptors, and there is the possibility to turning it more towards that bad estrogen, which is seen with estrogen dominant cancers. The bioidentical hormone replacement therapy, being natural, will also bind the estrogen receptors, but slightly differently, and there's not that increased risk that we do see with the traditional hormone replacement therapy.
Perfect. Thank you so much for clearing that up. Now, if somebody does start a treatment plan, they've got their diet, their lifestyle, maybe the supplementation or the bioidenticals, at what point in time do you reassess, or what would be the next step after that to really know, are things getting better? Are you repeating the labs?
Right. Yeah, absolutely. So what I often do is, regardless of treatment, I always repeat the labs. Like I said, our hormones are, constantly changing. But first of all, you do need a baseline for your labs. And then minimum, I will repeat yearly if you are in that perimenopausal range. If you are on bioidentical hormone replacement therapy, especially in the beginning, I will run those labs every 2 months for for about 6 months to a year, just to make sure that we're at the right level. So I need to base it on how you're feeling. So obviously I want you to be feeling good, but we also need to look at the labs and line those up to make sure that the dosage of that bioidentical hormone replacement therapy aligns with where you need to be in terms of how you're feeling, right? So we do definitely run those labs just to make sure that everything is looking good.
Yeah. Thank you so much for all of your information today. I can't wait to re-listen and take notes about all the different supplementations that you had recommended. That was fantastic. For anybody who's looking to connect with you, what is the best place for them to find you and find your information?
Yeah, you can check out my website. So drdaniellenaturopath.com. I'm also on TikTok, Dr. Danielle ND, and on Instagram at Dr. Danielle ND. So, you can absolutely find me there. Just search for me. And I also do have a perimenopause guidebook that I believe we're going to be sending that out to everybody. So yeah, definitely take a look. There's a lot of great information in there. A lot of the things that I've spoken about today will be in there. But please feel free to connect with me, ask me any questions that you want, and hopefully I can help you out.
And there's also a link that I see in and around this video on the side in the chat to book a discovery call with you, which is fantastic as well. So we'll include that for everybody. Thank you so much for your time today. Thank you, everybody else, for joining us on this call and sharing your knowledge and your expertise. Follow on Instagram, Health Buddha, and make sure to pay attention to your email because we will be sending out information with respect to the next webinar that we are holding. So thank you so much again. We really appreciate it, and we'll see you next time.
Okay, thanks everyone. Bye. Have a great day.